April 14, 2026. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute, neurosurgeon, board certified, and we're here with a patient who travels from Boca Raton, Florida. He has a 10-plus year history of debilitating back pain, starting to develop symptoms going down his legs called neurogenic claudication, from pinched nerves due to spinal stenosis and bulging discs. Long story short, we're going to fix 3 discs today. We're going to fix 2 of them on both sides and 1 of them just on one side. Let's go ahead and show our audience the 30 different causes of lower back pain that we commonly see. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see AP from our animation that there are 30 very specific sources to back pain, and our treatments at Deuk Spine target the exact cause of a patient's back pain. To identify each person's source of back pain from that list of 30, we do a special examination called the Deuk Spine exam. And during that examination, I use a combination of history, physical experience, and MRI. So really 4 things that help me, guide me to determine what that patient's pain source is. AP. Now those 30 causes are common for every human being, but some patients could have 1, some could have 3 or 4, some could have 5 or 6. I've had up to 15 specific causes of back pain in one patient. And what that means is that that patient's going to have 15 things fixed. Not very convenient, but at the same time, once they have those 15 things fixed, their pain will be virtually gone. And that's really what people want. They want to get rid of their pain. Shot? AP, looks like by the way, we're trying to get our needles into the L5-S1 disc on both sides. He's got pinched nerves on both sides. He's got back pain coming from the tear in the back of this disc on both sides. I'm having a little trouble on the left side because that is the narrower area, but I think we're good now. I'm inside the disc. At this point, I'm going to make an incision and place my second needle into the L4-5 disc. So we're going to be placing needles into the L5-S1 and the L4-5 on the left side. We're also going to do the L3-4 on the left, correct?
Yes, sir.
All right. So a little bit of scoliosis. I'm going to target the L4-5 disc. Any questions? No questions, Jason? Shot?
No questions at this time.
All right. Well, then let's show the audience how it is that a disc injury could be so painful for patients who have disc injuries with back pain. Shot?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, we are now entering the left L4-5 disc. We have one more disc on the left side, that's L3-4. Remember, this patient has 3 discs that are causing his back pain. Many patients have only 1 or 2. The average is 2.5. If you take all patients that came to Deuk Spine Institute with back pain, once we identified discs are the cause, it turns out that the average patient with chronic back pain has 2.5 discs causing their back pain. That's based on a study of 5,000 patients with chronic back pain that we did. Just about done. All right, let's take AP.
Okay?
Is he really awake?
Can you open your eyes for me?
That would be amazing. We got one more needle on the left and we got one on the right. Remind me what that is. the Christmas decoration shot? That would be neither of them. Anybody ever see the movie with Scarlett Johansson called, is it Ghost in the Machine? Ghost? It's Ghost in the Machine, right? Ghost. Let's look that up. Anyway, it's a movie from about, I'd say 10 years ago. Great movie. Sci-fi, futuristic. And everybody has implants in their bodies. Kind of like the Neuralink implant that Elon Musk is developing. But we already have people with implants today. And the reason implants are being promoted so heavily, folks, is that the companies that make these implants, they make billions of dollars putting them in your bodies. Turns out all these spinal fusions being done, in my opinion, many of them surgeons are putting metal in the body, spinal cord stimulators being put in the body, electrodes, generators, batteries, AP. This surgery you're watching right now uses no implants. And the beauty of this surgery is that we can actually cure your pain without a single implant. It's all natural. So you can see this patient has an implant further up on that x-ray. How is he doing, Sean? Huh? Think he can respond? No? A little too sleepy? All right, that's fine. We're done. So at this point, I've gotten access to all 3 discs on both sides at 4-5 and 5-1. We're going to be fixing 5 spots. I'll show you a little trick here. We're going to inject some of our special Deuk spine dye into the left side at 4-5, 5-1, and you guys can watch the dye come out on the right side because they're connected within the disc. Here we go. So first one will be this catheter. Watch as we strike oil. Look at that. See that? Pretty cool, huh? And then we'll strike oil on the next one. There it is. Here comes the blue dye going through the damaged disc and out the other side. Pretty crazy, huh? You can see on the discogram he's got annular tears. That's where his pain's coming from. And of course, shot L3-4. We don't have a needle on the right side, just the left. All right, we've done our discogram. Our patient is asleep. He has bad sleep apnea. We need to keep his airway controlled, so we're not going to wake him up and verify with an evocative discogram. You start to tempt fate too much, you might have problems. Any questions?
No questions at this time.
Amazing. All right, well, let's get started then. Show the audience our video on how to cure back pain that comes from a damaged disc.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Easy, easy like Sunday morning. All right, let's get the scope visualizing inside the disc. What's going on in there? It's a little dim and dark. Grabber. Folks, we are inside L3-4 disc. Luis.
Yes, sir.
So,
Start view.
look at the inflammatory tissue. That right there that I'm grabbing out is a piece of inflammatory. Look at the pink color. You guys see that? Pink color. All right, we know it's inflamed
Sam, do you mind to
because of the pink color.
increase the lights, please?
Laser. You guys ready with a laser?
Yeah.
Any questions? Did you show the video yet on how we use the laser to repair the disc?
Yes, we have. No questions at this time.
All right. The laser fiber itself is 1 millimeter. 1 millimeter. We have two different types of laser fibers. We have a small one and a thicker one.
Thank you. No, I go. It's good.
We use the skinny one with the small scope, and we use the thicker one with the bigger scope. The way the laser works, that fiber you're looking at is FDA approved for using it on a disc. We are using it on a disc. So the fiber is being used as the FDA has directed it to be used on a disc. The laser itself is a large size of 2 suitcases if you're traveling overseas. And it has a 220 watt plug. It basically generates energy in the form of a electromagnetic radiation. Electromagnetic radiation is sinusoidal wave-like radiation that travels through space and time in a wave-like fashion with a frequency and a wavelength. Basic physics. The frequency and wavelength determine the properties of that wave, whether or not it's going to be visible light or whether it's going to be another type of energy such as ultraviolet or infrared or microwaves. So in this case, this energy is at about, 450 nanometers wavelength, I believe.
Around there.
So it's perfect for this type of surgery. I apologize for the poor visibility, but there is a little bit of blood in the disc since we entered it due to all the inflammatory tissue we passed through to get this herniation out. If you go back and watch our animation videos, you'll see that the whole cause of the patient's back pain is a very, very, very small area of inflammation or redness that's happening in the back of the disc. In this case, L3-4 disc on the left side. Not only are we getting the bulge out that's pinching his nerve going down his leg, so we're treating the leg pain, but we're also getting rid of the back pain by treating the posterior annular tear and the inflammation within that tear. Any questions?
No current questions.
All right. Ghost in the Shell? I think it's Ghost in the Shell. Ghost in the Machine is a Police song. Police used to be my favorite band back in the 80s when I was in high school. Yeah, the lead singer is a guy named Sting. Some of you might know him, especially if you're an 80s child like me. I guess I'm a 70s child, an 80s pop culture, young adult, adolescent. Greatest of all times, 80s. Sorry, you Gen Zs and what is the newest generation? Gen Z? Gen X. You guys missed out on the 80s. Greatest time in our country's history. Greatest presidents, not counting Carter, and just pop culture. People hung out. Like, people did things together. You know, we didn't have cell phones. We didn't have social media. We had social. And Social meant on the weekends you would go to parties. Somebody would host a party, their entire block would be filled with cars. Kids would bring, drinks, and we'd play loud music, rock and roll. Came from overseas mostly. And we would have fun. We'd talk, we'd dance, we'd hang out, we'd get together. Getting together was pretty cool, right, Luis? And it was a great time in American culture, the 80s. There will be movies and books about the 80s forever. Unfortunately, now we have social media, which has pretty much destroyed the new generations. Everybody's got their nose stuck in a cell phone or a social media platform rather than talking and dancing and hanging out, doing stuff together. We would go out and play something called broomball on the weekend. Basically go to the ice rink where they have ice skating, and you wear sneakers and jeans and maybe some knee pads. You get a broom, you tape it up with duct tape, and you get a tennis ball, and you get out there and you play teams, just like ice hockey, except you're running around the ice on sneakers. And my God, you talk about fun. You're trying to score hockey goals, with the tennis ball and broom. Broom ball, we used to call it. It's the greatest of times. Brought people together. Now, I don't think social media really brings people together, does it? Pretty much isolates people into their own little world. People aren't integrating. They're just communicating. Anyway, since you guys don't ask questions, I got to talk. The greatest of times. I think we had the best music in the 80s. We had music from all over the world, not just American rappers or American country western singers. We had rockers. We had rollers. We had everything in the 80s. We even had punk and classical music. We had rock with classical music. Get that. I mean, you'd have rock ballads like Guns N' Roses with an entire symphony. Most beautiful music ever made, right? You bring in that electric guitar, the drums, and you combine it with a symphonic overture. It's just amazing. We created back in the 80s, 70s and 80s, and now we have AI do everything for us. We're done with this disc. I fear for the world. I fear for our future generations. Careful, careful. Let me have it. Putting a little antibiotic. We finished our first disc, L3-4 on the left. We're going to take out the tube. We're going to move on to the L4-5 and L5-S1 on the left. When I'm done here, I'm going to move over to the, thank you, Luis, to the right side and do the right side. So one disc out of 5 done, 4 more to go. Any questions from our audience?
No questions at this time.
Are you checking?
Constantly.
Huh. How many viewers do you have?
At the moment, 5.
5 viewers. That's pretty sad. We're broadcasting the most advanced laser spine surgery in the world, the future of spine surgery right here, and we got 5 people watching. Maybe I ought to operate in a bikini with some fake boobs. And then we'll get a few thousand watchers. I'm just kidding. We are very happy for our audience of 5. It's wonderful. I can't compete with those other Instagram models, right? Jordan? I don't know. You just seem like the kind of guy who dates Instagram models. Are you? Shot? You have higher standards, Jordan? All right. So we are now in L4-5. We're putting our tube down. We're going to see inside the L4-5 disc. Jordan, what's one thing we're going to see in that disc? We're going to see blue dye. We're also going to see a needle shot because we have a needle on the other side. So we're going to see the needle from the other side. Now, last time I did this, I got a little close with the laser to the needle and I melted that needle. We had to replace it. This laser, people ask me, Dr. Deuk, can your laser remove bone spurs? You can't remove bone spurs, can you? Of course we can. We can remove metal. This laser is so powerful, we're not even using it at full power. We're using it at half power. And we're melting steel. That's how powerful the laser is. This is a holmium YAG laser. It's made in Israel. It's the best medical laser in the world, and it's the best for this particular application, fixing disc problems. That's why I've used it for 20 years. I've had the opportunity to use other lasers, but this is the best. There was a company called Trimedyne. They used to sell lasers 20 years ago when I got started, and I had to choose between the Luminous and the Trimedyne, and I chose the Luminous. There's a reason for it, a couple of reasons. The most important is that this laser produces a very powerful ejection of energy, and when I put it into this liquid solution that we run through here, you guys are seeing the water floating by. There's a piece of inflammatory tissue right there, by the way. See that red thing? Anyway, when laser energy pulse is emitted from the tip of this fiber optic cable, we call it a fiber, it creates a cavitation wave, like a pressure wave, inside the water, inside the liquid, the sterile saline that's in there. And that cavitation wave, or pressure wave, blasts out pieces of herniation. I'm getting it all over my shoes.
Sam, can you check the place over here on the floor, please? Can you check for
So
water on the
it's a
floor?
combination of laser energy being absorbed by tissues, causing those tissues to break their covalent bonds, holding them together. Those are protein bonds typically. Because these are proteins, scar tissue is made of collagen, and herniated disc, which is the nucleus pulposus, is a lot of proteoglycans. So basically what's happening is the laser energy that I'm directing to this tissue right here, like this piece of herniation, gets absorbed by the tissue. It gets absorbed specifically by intermolecular bonds and breaks those bonds apart through kinetic energy. Any questions? Grabber?
No new questions.
All right. I can actually feel the needle from the opposite side down here, but you can't see it yet because there's still a bit of schmutz down here. Maybe we won't see it at all. It's right behind that blue stuff. Okay, I'm going to pull this back just a little bit. I've got about 5 minutes on this disc left. There's some more inflammatory tissue. The key to pain is inflammation. Inflammation is the cause of pain in the human body. Physical pain, physiological pain comes from inflammation getting onto little fine nerve fibers called type 4 fibers or class C fibers. There's a specific type of nerve fiber that transmits pain signals. They travel in your spinal cord via the lateral spinal thalamic tract. And they don't travel in the same path as, say, fine touch. Fine touch travels through your dorsal column medial lemniscus pathway up to your midbrain and then up to your cortex through the thalamus eventually. The thalamus is the gateway of all stimuli. All sensory inputs travel through your thalamus, which sits on top of your midbrain. You've heard of the hypothalamus probably, but the thalamus is something that most people never talk about because they don't understand it, its role. But it is a very important gateway. In my opinion, one of the most important structures in your brain is the thalamus. If you didn't have a thalamus, you would be in living hell for the short life that you would have. The thalamus basically blocks most sensory inputs from ever reaching your cortex and making you consciously aware of them. Kind of like the feeling of your shirt on your back or your underwear around your waist. You don't feel those things because they're there, they're pushing on your skin, they're activating nerves, but your brain ignores them largely because of your thalamus. Your thalamus doesn't allow those sensory inputs to reach your consciousness. All right, no questions?
No questions.
All right. Very good. All right, we're done here. So what I'm seeing is he has very little herniation, but he's got a lot of inflammation. So everyone's different, huh? Yeah. Every person is different. Some people have more herniations, some people have less, some people have bigger herniations, some people have smaller herniations. The number and size of herniations varies from just a few, they say 5 or less, up to 50 per disc. In this patient, what we've seen so far are 2 discs with minimal amount of herniations, but there's a lot of inflammation. So he has good reason to have pain. Just wait, I want to see it on the x-ray first, because it moved a little bit. Let's go lateral. This will be the last disc on the left side that we're treating. Shot? Yeah. All right, so far we've lost very little blood, probably 5 cc, not 5, maybe 1 cc, 2 cc. We will lose 5 cc's at this rate. 5 cc's is 100 drops. If I had done open back surgery on him, he would lose 250 cc's. Most spine surgeons would lose 500 to 1,000 cc's. So 5 cc's is, Dr. Berndes, what would you call 5 cc's of blood loss? Huh? It's like a tablespoon. It is a tablespoon. No, it's a teaspoon. 5 is a teaspoon, 15 is a tablespoon. So it's basically, hold on, shot. It's basically 1 teaspoon. Yeah, that's a good analogy. I like that, Dr. Berndes. I like that. That gives people some perspective. We will lose a teaspoon of blood during this surgery. So far, if we continue at this rate. Because we got a cc per disc. So we got 5 discs, 5 areas. Yeah. And 5 times 1 is 5. Huh? For some people, right? Is it hard? There's a lot of narrowing here, that's why. This side is very narrow. All right, good job, everyone. How many viewers do you have on YouTube? Any way to tell? Can you tell how many viewers you have on YouTube?
We on YouTube. Yeah, one moment.
I'm sorry?
Checking on that right now.
All right. There we go.
We currently have 3.
We have 3 on YouTube. How many on Facebook?
0 on Facebook.
Is it even streaming on Facebook?
They are all streaming. I can see that.
How about Dr. Berndes, could you go on Facebook for me? So we can have at least one viewer. Just think about it, Berndes. You could go on Facebook, social media, and you could see the surgery better there than you can see it where you are. Huh? Do you see one viewer? How many people on Facebook now? By the way, I'm pulling out pieces of herniation. We're at 5-1. There's a lot of pieces of herniation. More than I expected. Look at all this stuff here. This is all herniated disc. What's going on? Huh?
Nothing wrong.
What are you thinking Jordan for?
Oh, because he's giving some records.
He's what?
He gave me some records. He gave me some records.
Oh, Ratex. Sorry. I was wondering what he was putting on the field. This is the L5-S1 annular tear. It's quite surprising to me. I thought it would be more degenerated, this part at least. But as we get towards the outside of the tear, because right now we're inside the tear in the middle, sort of, if you think about an annular tear, it goes from the outside of the annulus right through the middle to the inside of the annulus. So the annular tear is probably about 3 or 4 centimeters in this patient. It could be bigger, maybe even up to 5 centimeters, 50 millimeters, if you think about it. Just depends on the patient. Some patients have bigger discs. Some patients have smaller discs. It depends on their anatomy, the way God made them. So I've seen some lumbar discs where the annulus will be 3 centimeters or 30 millimeters. I've seen others where it's up to 50. It just depends on the person. Eight people watching on Facebook. You have 8 viewers on Facebook. Or Facebook, YouTube, LinkedIn.
2 on Facebook, 4 on YouTube.
All right. You guys have different numbers. That's weird. Berndes has 8. You have 6, right, Jason?
4.
4. But you have, anyway.
Yeah, he says 6.
There's some inconsistencies that we're getting. Anyway, if anybody has a question, feel free to ask. We are inside the left L5-S1. Look at this right here. This big piece of scar tissue, herniation mixed together, is pushing on the nerve, just crushing it. We're just below the nerve right now. This is the nerve root. We're talking about nerve root. For those of you who don't know, there's a difference between nerves and nerve roots. Nerve roots are nerves, but they're a special kind of nerve that comes out of the foramen, carrying motor and sensory information, along with autonomics. And they have a dorsal root ganglion, which sits right inside the foramen. It's a bunch of somatic or cell bodies of neurons that make up the sensory system. this is all pushing out right here. Look at that. All those pieces of herniation. If you slow this video down on your television or its phone, you'll see all these little chunks just flying out. There's a bone spur. Goodbye, bone spur. Here I'm looking lateral. You always want to get the lateral herniation as well as the medial. When I first started doing these surgeries, I didn't really do much lateral herniation removal. And then I had a patient who had a really primarily lateral herniation. So I had to spend a lot of time looking laterally, and I ended up getting pretty good at it. All right. There's the end of it. There's a little bit of fat right around the dorsal root ganglion. This is all herniation right here. You guys see that? Shouldn't be there. Bone spur, fat. Why is there fat around the nerve root? Anybody know? Energy and protection. That's the answer. Your nerves can use fat as a source of energy, whereas your brain cannot. Your spinal cord cannot. The central nervous system only uses sugar or ketone bodies. And just triglycerides or fat, lipids, cannot be used for energy by your brain. But it can be used for energy by your nerves. All right, just about done here at 5-1. Just have another minute left. Trying to clean up as much of the herniation as I can. This white stuff is all pieces of herniation. They say it looks like crab meat. I have to agree. If you've ever had crab meat before, that's what this herniation stuff looks like. Crab meat. I will tell you, a normal nucleus does not look like crab meat. The herniation does. So this is all very abnormal. By the way, our surgery is a one and done. We don't have to do more surgeries at the same place. Patients may develop a different area of pain, and then they come and have that treated. But once we fix the disc, it's fixed forever, unless they re-herniate it, of course. This is the last bit of herniation right there. It's sitting right underneath the nerve root. You guys see the nerve root right there, the white thing? That's the nerve root, right under the fat. That's fat, the yellow, and underneath it is the nerve root. And we're just below it. That's how close we are. Okay? Scope off. Gonna put a little antibiotics. We've never had an infection in 20 years of performing the Deuk laser disc repair. This is the most advanced laser spine surgery in the world with the best results. We have the highest success rate at curing pain of any laser surgery. We have the highest, fastest recovery, which is generally 1 hour. And we have the lowest complication rate of any laser spine surgery published to date. We have 0 complications in 2,760 procedures. I think we have the highest patient satisfaction too. I'm putting staples. We'll get these staples out tomorrow when the patient comes in for a quick checkup. We'll get these staples out. Look at that, folks. 7 millimeter, 1/4 inch incision. Tiny, tiny, tiny. He can wear his bikini and no one will see this thing. Hey, you know, these days, guys can wear dresses, bikinis, skirts. I don't want to be sexist here. Okay, got 2 more discs to go. Any questions?
No questions.
Shot. I'm going to place this guide wire in. Hold this here. Yep. Shot. Uh-huh. Very good. We're doing L5-S1 on the right side. Two more discs to go. 15 minutes, Berndes. 15 minutes. Implicator. Resurrector. What? Don't give me that nonsense. There's no way we've been here for 75 minutes. Maybe, how long, when did I come in? Huh? What is it now? 1:45? That doesn't surprise me, Mr. Slowpoke over there. Just giving you a hard time, Berndes. You can laugh. How many minutes did you say? 75? What is that, an hour and 15 minutes? So I've been here 45? So you guys had 30 minutes more than me. Yeah, fair to say?
I would agree with that.
But that's pretty typical.
Yeah.
I mean, to put some...
Get the positioning.
Yeah. Prep and drape, all that stuff. All right, well, I think we'll be done soon, probably by 2 o'clock.
We only have a piriformis.
Yeah, we have one more surgery after this patient. It's a
I think the patient's from Michigan.
piriformis release in a patient who traveled from Michigan to Florida to Deuk Spine to have their piriformis treated. Okay, there we go. We are now inside L5-S1, right side. There's the herniation, that blue stuff. There's the inflammation, the red stuff. Grabbing some of the herniation, pulling it out, getting rid of it. Why don't we show the audience, since this is a long surgery, let's show them the 30 causes of back pain once more. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4 mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining.
We have just shown you the 30 different causes of chronic back pain. Chronic back pain means back pain that typically is lasting more than, say, 2 weeks. And the chronic back pain has very specific causes. Deuk Spine Institute is the first in the world to discover those causes and report them. Here in our video, in our animation, and we published that over a year ago, actually 2 years ago. So back in 2024, we identified through a series of studies on our patients, looking at 5,000 people with chronic back pain. Where does the pain come from? And we verified that by doing surgery on those areas in the vast majority of the patients, okay? And once you do surgery on where you think the pain is coming from and it actually takes the pain away, then you've just verified the pain source, didn't you? So we've been very successful at identifying and curing back pain now for 20 years at Deuk Spine. Let me see. I think we're just about done. I got that little piece right there I want to get. You can see the scar tissue, the herniation. Right here, it's blue. So, done. There's some fat billowing, which fat is normal here. We like fat here. Fat is good. It's normal to have fat in your neuroforamen. As a matter of fact, when you start to develop foraminal stenosis, the first thing that goes is the fat. So when you do surgery on people with bad foraminal stenosis from facet hypertrophy or disc herniations, you'll notice the fat is gone, and that's not a good sign. All right, take a look over here. We pulled out a few pieces of herniation on this disc. We got one more to go. Guys, look right here. You see this?
Yes.
Got some nice big chunks of disc herniation from L5-S1. All right? Any questions from our audience?
No questions.
All right. Gosh. They have immaculate knowledge. Come on in, Jordan. I would say 8 minutes, Bernadette, 8 minutes. This is the right L4-5. It is our last disc we're fixing. Let's get the blood pressure down just a little bit. It's not bad. His blood pressure is in the 120s. Systolic, which is normal, but during surgery we like to keep it below 110, below 110. Of course, we don't want it lower than 70, but we want it somewhere between 70 and 110. Usually 80 and 110. 70 is a little dicey. Right, Berndes? All right. Shot? Well, Henry has left us, and he's moved on to bigger and better things. He's in Nashville, Tennessee. Talked to him a few days ago, and he's doing well, looking for a job. So if you're missing Henry, well, that's why he's gone. We have now Jason and Anthony, who are at the helm of the Starship Enterprise. Starship Deuk. You're going to make sure that pin went in Dominican Republic. Huh? All right, well, it hadn't been done yet. Seven minutes and counting. Grab-a-lab-a-ding-dong. You're holding out on me on that? That screen over there? Huh, Sam? Making me have to stretch my neck like a hyena? Anybody ever see a hyena in real life? Do they have hyenas at the Brevard County Zoo? Huh? Do they? What's your favorite animal at the Brevard County Zoo? Jordan. Which one? Jesus, Jordan. That is pretty funny, Jordan. That is pretty funny. All right, I guess we'll rotate over to Sam. Giraffe. Your favorite animal is the giraffe. Why? You can feed him. You mean you can feed him something other than your arm?
Yes. Lettuce. I think it's lettuce.
Because you can feed the bear, but he might take your arm with it. All right, so you got giraffe. One vote for giraffe. Dr. Berndes. You fed the giraffe? Yep. At the zoo? All right. So we got 2 giraffe votes. Favorite animal at the Brevard County Zoo? Luis.
I would say
The rhino. Nice. I like the rhinos too. My favorite? Anybody guess? How about you, Jason? Favorite animal at the zoo?
Elephants.
Elephants. And we have Anthony in there?
I think lions. If
Don't
they have
say great white sharks.
they don't have those in zoos.
Huh?
I'd
Did you say the bees?
no lions?
Lions. Fair enough. That's a good one. Lions. Mine? The most sophisticated, intelligent animal with the most complex behavior, most adapted to its environment. That's my favorite. Anyone know what that is? No, not a monkey. Anybody? Anybody? Snake? No? Pretty good guess. Humans. All right. Look at that inflammatory tissue, Luis. Look at it. All that red and pink. All that stuff is where the pain comes from. And we are getting rid of it right now. Humans are the most fascinating, highly adapted to their environment, complex behavior and social interactions. Right? Humans are my favorite animal at the zoo. Some people don't know that humans are animals. Did you guys know that? Anthony, did you know humans are animals?
Yes, I do.
Yeah. Yes, we are animals.
So you like people?
I do. You ever see people act like an ape when they're standing next to the apes? Huh? Ooh, 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 oh, 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 oh. All right, folks, we are done. Done with the fun. This is the last piece of herniation, and we'll be coming out finished. We did 5 discs, 5 areas, really 3 discs, but 2 of them were on both sides. We count that as separate because it requires a separate incision, separate treatment, an entirely separate treatment. So thanks for joining us. We'll be back in about 30 minutes, maybe a little less. Depends on how long it takes Dr. Berndes to wake this patient up. And we'll be back for a piriformis release. So remember, the piriformis is probably the second most common cause of back pain. I used to think it was the facets, but I think we underdiagnosed piriformis for a long time, like many doctors do. Second most common cause of back pain, piriformis syndrome. And Deuk Spine Institute has a permanent treatment to get rid of piriformis pain. It's called the Deuk piriformis release. It is patented, completely FDA approved, and highly successful at eliminating pain in the buttocks. It is least invasive, no bleeding, no downtime, 4mm incision, and no hospitalization. A lot of surgeons are doing open piriformis release. They're hurting patients big time. Check out the Deuk piriformis release next here at Deuk Spine Institute. Once again, thanks for joining us.